sponsors. AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome, all my friends from South Florida and around the country. We have a special guest with us now, Delroy Clark. Delroy has just joined us from New York. He was the controller of the YMCA in all of New York. He decided he wanted to get in the healthcare business, and we were lucky to bring him in here at All County Healthcare. We have a great guest tonight. Matter of fact, he's a young guest, young, good-looking guest, and he decided he wanted to go in the rheumatology business. He wanted to become a doctor. He was a Florida resident originally. Doc, tell us, Dr. David Dillon. Doc, tell us a little bit about yourself.
So I was born here down in South Florida in Hollywood, and I grew up in the
speak a little louder,
area.
Doc?
Can you hear me now?
Go ahead.
Yep. So I'm from. I was born in Hollywood, grew up actually in the Jupiter area, and basically did my undergraduate up at the University of Florida. Then came back down here for the majority of my medical school and residency training. And then went up to Charleston, South Carolina for a couple of years to do my fellowship, but then decided I missed the sun and the fun of South Florida, so came on back down here to Southern Palm Beach County to join Rheumatology Associates of South Florida, who I actually worked with when I was a medical student. So really neat to have it come kind of full circle for us.
Doctor, are you married and have any children, or are you single? What's the story?
Yep, I'm married. My wife's actually a psychiatrist, child and adolescent psychiatrist, and then I have a 7-month-old daughter tooling around somewhere around here. So apologies if there's any ruckus going on in the back.
Well, that's fantastic. And Doctor, you joined the great group of rheumatologists. You joined the name of that group was the Boca Rheumatology?
So it's Rheumatology Associates of South Florida. So we have offices in Boca and Delray. But it's the group with Ira Pardo, Jody Forscott, David Albuquerque, Sean Baca, Corey Ulrich. And then I joined along with Dr. Alexis Katz back last fall. So that's the core of the group.
Jody's a great guy. As a matter of fact, Jody Forsstad has been a physician for a number of years in Florida. He also sponsors the Boca Hoops. He runs the Boca Hoops. That's his passion. We happen to be a contributor to the Boca Hoops. So we've known Jody for a long time, Dr. Forsstad, and he does a lot. Matter of fact, I use him as my rheumatologist. So tell us about rheumatology. Tell us basically, is it a study of the skeletal? What is rheumatology in essence?
So rheumatology, it ends up being really a hodgepodge of a lot of different things. The rheumatology kind of stems from the study of disorders that affect the muscles and the joints. So it really entails a great many things, various forms of osteoarthritis, inflammatory arthritis like rheumatoid psoriatic arthritis, other nastier diseases like lupus and scleroderma. But then we also end up doing a good deal of non-operative orthopedics. We do injections. We do various manners of treatment for different kinds of soft tissue aches and pains like tennis elbow, golfer's elbow type things. And then we also do other types of diseases as well, like osteoporosis and some of the metabolic bone diseases as well. So it ends up being a good mix of things, enough to keep us on our toes every day for sure, which is one of the parts that I enjoy about it, the variety.
What is did people turn to osteoporosis? What is osteoporosis? Is that a inflammatory of the joints? Because my mother had that, and I never understood really what osteoporosis was.
So osteoporosis is a tough one. So it's a condition really of decreased quality and mineralization of bone. That is to say that the bone becomes more almost sponge-like in character, and we more often see it in postmenopausal women due to the loss of the estrogen effect, which helps mineralize bone. So we tend to see that a lot in the postmenopausal crowd, particularly women over the age of 65. And the issue with that becomes as the bone loss accumulates with time, it predisposes folks to fractures, and really fractures that, they might not necessarily engage in any activity that would, prompt it per se. Stepping down from a curb and misstepping onto some pavement can result in a hip fracture. So it's a really problematic condition in the sense that it's kind of a silent disease. We certainly have screening tools that can help us with it, but it's a big public health problem. It certainly causes a lot of healthcare expenditure and some trouble certainly for people who incur fractures, everything that goes on with hospitalization to fix the fracture and all the recovery that goes along with it. So it's a tough problem to see.
Is there any cure for that?
Yeah, we have actually now it's a pretty interesting time, certainly in osteoporosis. We have a lot of good medicines, a lot of oldies but goodies, and then there's been some new ones coming down the pipeline as well. So we certainly have a pretty good armamentarium that we can choose from for our patients. So it's a good time certainly to, if you're going to have osteoporosis, to have it in the sense that we have plenty of options available.
So Doc, if anybody wants to get in touch with you right now, let's say for consultation, they can come to you for consultation. Let's say they went to another rheumatologist and they want another opinion. They can come and see you or see Dr. Forstad in your office. Am I correct? Your office right now is located at Northwest 15th Street. That's 1050
yeah, we're
Northwest.
Over in Boca, behind that big, the P.F. Chang's and that Barnes & Noble Plaza right there behind Glades and 95.
And your phone number down there is 561-368-5611.
That's the one.
Is that correct? 561-368-5611. You also have an office at Delray, am I correct?
Yep, that one is actually, we're right just a touch east of the Delray Medical Center. We're over at the corner there of Linton and Military.
Okay, that's at 5162 Linton Boulevard, Suite 101. And that office number is 561-498-1114. Delroy, do you have any questions to ask the doctor? Would like to know anything about the rheumatology or what he does?
Yes, doctor, what exactly is arthritis? There's a lot of misconception out there about arthritis. What exactly is it?
Sure. So arthritis, I would agree. There's a lot of, the description of the term, it can go various ways, but it kind of encompasses a good number of conditions, certainly osteoarthritis, which is basically wear and tear, so wearing away of the cartilage that serves as the cushion between two bones. Almost think of it as kind of losing the tread on the tires in a sense with age, with use, with cumulative impact. That one's kind of a tough one to treat because we don't have anything really that can reconstitute the cartilage, but we certainly have strategies to work around it. The other kind of flavor of arthritis that we see is conditions called inflammatory arthritis, which includes, the big ones really are rheumatoid and psoriatic arthritis, which involves the body kind of responding almost to the lining of the joints as if it's a foreign invader, almost like an infection. So there's destruction of the lining of the joint by the immune system, almost friendly fire, but for a bad reason. And so as a result of that, we have a lot of medicines now. If you watch the 5 o'clock news, all these crazy medicines that we can use for it. So even though that's not a very pleasant diagnosis to have, it's an exciting time in terms of the therapies available because there's really a great many new therapies now that we have in our quiver in a sense where we can target inflammation in different ways. So those are really the main two flavors in terms of osteoarthritis or degenerative arthritis, and then inflammatory arthritis.
Are there preventative measures that one can take to alleviate arthritis, or it's just, a natural cause?
No, that's a good question. I get asked that every day. Some of it, unfortunately, is a bit of genetics and to some extent bad luck. With osteoarthritis, degenerative arthritis, there's to some extent a strong family component, heritability component to it. But certainly, we tell patients who possibly have that kind of family history doing things like making sure you're in good physical shape, keeping the muscles around bones strong, can help with that. On the other side, in terms of preventing things like rheumatoid and psoriatic arthritis, we don't have as many good things to prevent that. It's been well demonstrated that smoking is a big time risk for development of rheumatoid. So we always caution people not only for other health issues, but for rheumatoid risk, certainly to quit smoking. But with that one, we really don't have a whole lot, at least as yet, where we have good recommendations to say, do this, don't do that. That one too, there's a big component of genetics about it. So it's one of those things that we often kind of deal with when it arises.
Are there symptoms that one should look for?
Good question.
To see if, I might be going down the arthritic path here. Is there symptoms to look for?
Sure, that's a very good question, and one that, as rheumatologists, we try to really emphasize this with our colleagues like in primary care and so forth, who are really on the front line seeing patients, to get patients with certain signs and symptoms into us early, because the initiation of therapy early on can prevent damage. So really those would be pain and swelling, particularly in small joints. So we typically see rheumatoid show up in this row in the hands, the first couple rows, with a lot of swelling, redness, warmth. It tends to be worse in the morning time. So that's really a worrisome component. On the other side, certainly with osteoarthritis, because it has to do with use, we tend to see wear and tear arthritis pain get worse toward the end of the day, whereas rheumatoid type pain tends to be worse first thing in the morning. So that would really be an impetus to seek rheumatology evaluation promptly, because of the risk, certainly with rheumatoid, as the damage from the inflammation accumulates, that could lead to irreversible changes, hence our push to identify these patients very early and get them on appropriate therapy early to prevent those changes from setting in.
Doc, we're going to take a 30-second break to get in a little commercial. And for the company that sponsors this show is All County Healthcare. So we'll be right back with you within 30 seconds. Thanks, Doc.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do. Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Longer and healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back with Dr. David Dillon. He's with Boca Rheumatology Group. And right now, Dr. Dillon's office, as I told you, is at 1050 Northwest 15th Street, Suite 212A, Boca Raton. And the phone number is 561-368-5611. I think that's right across the street from FAU, isn't it, Doc, 15th Street?
That's correct, yep.
Right across from FAU. A little hard to find, so when you're coming down, let's say, Glades Road, you're going to look at FAU. 15th Street is right to the right. You take it right there, go around the corner, and you'll see the office space right there. He's a fantastic young man because I had a chance to meet him at Dr. Forstat's office. He doesn't remember me, but they had me on the table and they were doing a few injections. So that brings us back. What are some of the treatments, Doc, for so-called arthritis? Is it all surgery? Is it no surgery? What are the treatments that take care of arthritis? Or
so
what you do?
It's not necessarily surgery. We're kind of where we come in at the beginning side. We try to certainly keep folks, if we can, away from surgery, but sometimes if the horse is out of the barn, that's what folks ultimately need. But my approach typically involves a combination. I really like early implementation of physical therapy, really to have patients work on strengthening the muscle groups around an involved joint area. That typically does a great deal of good in terms of offloading a painful joint by being able to strengthen muscle around it. That joint has to do a bit less of the work in a sense. Other things that we do include steroid injections. We do some of the gel shots or viscosupplementation as it's known, kind of the WD-40 in a sense, where we'll do the medicines like Euflexa, Ialgan, some of the other ones out there that can be helpful. And then really, at that time, certainly if things haven't gone the way we would like it and physical functions being affected, that's when we typically say it would be a reasonable time to go forth with surgery if the patient was a medically feasible candidate.
Well, I know, a lot of people they figure they have knee pain or need a new knee because they have knee pain or hip pain. But when I went into the office and I had two knees that were really in bad shape, the doctor told me, listen, it's arthritis. You got arthritis around your knees. So arthritis can affect anywhere, right? Around your knees, your hips, anywhere. Am I correct? The shoulders?
Yeah, it tends to affect a lot of the weight-bearing joints. So we tend to see a lot of knees, hips. We can see it show up in the low back where we have changes that go on in the lumbar spine. We see it at the thumb bases a lot as a big one, certainly in the hands. Less common, we tend to see it in ankles, wrists. We could certainly see it in shoulders, especially people who have a lot of rotator cuff damage and a lot of the tennis and pickleball that goes on down here. There's certainly a good amount of wear and tear going on rotator cuffs, and the shoulder joint can get damaged and so forth. So it shows up certainly in a lot of places.
So if people were doing, like in the younger age, they were doing a lot of sports, or they did a lot of running on hard surfaces, eventually as they grow older, they can develop a certain amount of arthritis, especially as they get heavier. So is weight a problem with arthritis? If you lost weight, would you feel better with the joints? Is that some of the problems? Is diet a problem?
We always recommend that, in terms of weight loss, a good amount of, decreasing the poundage can really eliminate some of that impact on a painful joint. So that's never an unreasonable way to go. And especially we often tell patients, certainly if the joint is looking, somewhat like it's possibly on its way to needing an operation, it's always good certainly to shed some of that weight in advance of possibly needing a surgery as well. So never a bad idea, certainly, to try to lose some weight, to offload those joints, because it's really a gravitationally based process, and with wear and tear, the extra pounds don't do it necessarily any favors.
Now, you dealt with some sports medicine too, correct, Doc? You do a little sports medicine too on the side in your practice?
Yep, yeah, we do, injections for things, like carpal tunnels. We do dequer veins, which is a painful condition that involves kind of the inside of the wrist here and causes a lot of pain along the thumb base. We do injections in terms of smaller joints in the hands. If those are bothersome to patients, we inject shoulders for rotator cuffs and so forth. So it's a good, a good mix of things that we can do to avail some relief to painful spots for our patients.
Is trigger finger a form of arthritis, Doc? Trigger fingers? Is that a form
We kind of consider that more, it falls into the category of what we consider to be soft tissue rheumatism, but it's a mechanical thing caused by one of the pulleys that basically align the tendons that help movement. Almost think of it as like guides on a fishing rod. And at one point, the fishing line gets a little bit too tight to pass through the guide. So that's what would cause a trigger finger. And things like occupational therapy for hand therapy, and in some cases, injections can actually be quite helpful for that.
And do you treat the finger? Do you treat this whole thing called trigger finger?
Yep, yeah, we do. We do the injections. I tell patients they don't hurt me one bit. They're not the most comfortable ones to go through because there's a lot of nerves in the hands, but oftentimes they can be very helpful.
Trust me, I had them. I know how painful they are. Doc, let me ask a question. Do you accept Medicare? Of course.
We do.
And what other insurances do you accept?
So we have a good handful that we do. Humana, Cigna, Aetna. Those are the big ones that I typically see. Blue Cross we see a lot of. We don't. We have more. There's some United plans that I believe we accept, but it's best to call the office certainly first, and then we don't unfortunately do Medicaid. But Medicare patients serve really as a great majority of the patients that we see. So
Medicare is the most.
Yep, a lot of Medicare, and really a lot of the big commercial ones, really, except for United, is the one that kind of we have the most limitations on.
Well, that's great. Delroy, you have any questions you want to ask the doctor
sure.
right now?
The whole process of treating arthritis seems counterintuitive because to get arthritis is through excessive exercise. But to kind of treat it is, you're saying, to exercise to build up the muscles around the joint. So what specific exercise should someone do to build up the muscle?
So it's a very good question, and would agree. It's in a sense it is counterintuitive because we tend to think of it as sort of a use-dependent process, especially with osteoarthritis. But what we like to tell patients, for example, with knee osteoarthritis, doing things like seated leg lifts, so just basically even sitting in the couch and just extending one's leg and holding it for a bit to activate those quads, bring it back down and repeat that. That can help strengthen the quadriceps muscles and keep the patella better aligned so that the biomechanics are more favorable. There's a lot of other exercises that the therapists help patients with in terms of core exercises to help them be better stable and better aligned on their feet so they're not transmitting forces to either one hip or the other. So often we really rely on our physical therapists a great deal to do a good assessment of the patient, kind of see what they're able to do, and then gradually introduce some activity that they can do comfortably. That's a big part of our treatment approach.
David, we have about 1 minute left. Let me ask you a simple question. You now have just gone into the practice a very short time ago, right? You know what I always say? He has some people that have been in the practice for over 30 years teaching him, but just think, he's a young guy. He has all the new ideas. He has everything that's brand new. So if you're looking for a good rheumatologist who got young ideas and fresh ideas, who's been trained by probably some of the best in the country, I suggest you call Dr. David Dillon, at least for a consultation. Doc, you also do second opinion consultation too, right?
Sure, happy to do so. Review records and so forth, and past treatments, and try to help folks out any way I can, for sure.
So don't forget, call him at this number, 561-368-5611. A young, good-looking young man, Dr. David Dillon. Doc, God bless you. Good night. Stay safe. Wear a mask. Do what you got to do, because I know your office is very safe, because every time I go in there, you got to be careful.
Thank you, Doc.
Yeah, we run a pretty tight operation in there. Thank you both for having me, and I really appreciate it. Thank you all so much.
And tell Dr. Forstad I said hello.
I'll let him know.
Thank you. Bye.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed